What's up everybody, Dr. Tomassian here. Today we're talking about acne types and acne treatments. We have a lot to cover, so we're gonna get right into it. First thing we need to talk about is what are the types of acne. One of the most common types is comedonal acne. This presents as little whiteheads, little blackheads with not a lot of inflammation. A lot of times people are like, oh, my skin is very textured, it's very bumpy, and a lot of times that is comedonal acne, and you just don't know it. The next type of acne is inflammatory acne. This is the more red, juicy pimples you get. Has a lot more redness around it. It leaves the redness when it's gone. A little bit of more painful as well. Third type of acne is probably the most severe is Nodulocystic acne. This presents as very deep nodules, cysts. A lot of people try popping these and they can't. Nothing comes out because these are really deep-seated acne bumps. They cause scarring, they cause a lot of pain, and probably the most severe to treat and the most important to treat because you want to prevent that scarring that can be permanent after your acne. Lastly, I want to talk about hormonal acne. This typically affects females. It could be as late as the 40s, it could be early as teens. This is painful cystic acne around the jawline, around the chin, and it can be also on the forehead, but typically it flares around 1 week before the period, and that's due to basically the increased androgen hormones. Now that we know the acne types, we can talk about acne treatments. Starting off with comedonal acne. The two mainstays of treatment for me are retinoids and benzoyl peroxide. Retinoids are OG, my favorite. They work for so many conditions, but especially for acne, they are great at clearing out and speeding up the cell turnover to prevent sticky cells from blocking your pores. Benzoyl peroxide works great with it because it could also kind of clear your pores, but it's also antibacterial, it's anti-inflammatory. It's a great medication when combined also with retinoids. If you don't like benzoyl peroxide or you're very sensitive to it, another good option is salicylic acid. Anti-inflammatory, it's able to penetrate your pores, it's able to clear out a lot of that sebum, a lot of that skin cells, and really clear out those clogged pores. If you have inflammatory acne, that's when a dermatologist or a primary doctor is a great option. This is when topical antibiotics or even oral antibiotics are needed to really take care of that inflammation and all of that redness. If you have nodulocystic acne, I'll be honest with you guys, I see a lot of videos of people with terrible nodulocystic acne. They try to treat this with topical medications. I love topical medications. I love over-the-counter medications, but there's a time and a place for everything, and that is not the time for it. That's when you need something like Accutane or isotretinoin to really go treat inside out, to really take care of the acne, to prevent the worst thing, which is scarring from your acne that's permanent. A lot of people aren't worried about their acne, but then 20, 30 years later, they're like, oh, I have all these scars from their acne. That's the importance of treating your acne super early to really take care of the complications of the acne. Hormonal acne is another semi-tough thing to treat topically. The topical treatments work a little bit, but they're not great. To really treat the underlying problem, we like to use Spironolactone, which is a blood pressure medication that regulates androgen receptors, as well as oral birth control pills. So oral combined birth control pills are great. However, progesterone pills, progesterone IUDs, they actually make your acne worse. So it's important to determine which birth control you need, but if not, Spironolactone is a great option and something we prescribe as dermatologists all the time. Now that you know the types of acne and the different types of treatment, you are better equipped to treat your acne, not only at home, but actually have some information to go into see your doctor. These dermatology visits are sometimes pretty quick, so at least you have some understanding of what type of acne you have to relay that to your doctor. Or when you go to the store, you know what to go buy and not spend money on things that may only help slightly, but not really treat the underlying problem. I hope that helps a lot, guys. Thank you guys so much for watching. Drop comments on what you guys want me to elaborate more on, talk more on, and any other ideas. Appreciate all your support, and I'll catch you on the next one.